Hello again to our Melamed community. We are happy to be back. I'm Dr. Norma Mobley with Dixon, and we are going to talk about cultural competencies today. Please feel free to engage us with making comments and things that we can do to meet the needs of our Melamed community better, and like and subscribe.
Absolutely. Like and subscribe and share with your friends. We love to make this community even larger.
Right.
Yeah.
So when delivering care to our patients, it is vitally important that we acknowledge their culture and be respectful of that. Even things as simple as pronouncing their names correctly is very important. And there may be things that they practice that we need to acknowledge and not make them feel like they're being judged because it's something different than what we might do.
Yeah, and we know in lots of communities, there are things that we just do culturally. Like in my family, back in the day, you had to have that teaspoon of castor oil.
Oh my goodness.
To keep away whatever was coming your way. I've said it to my kids now. They're like, no, Mama, we're not doing that.
My father said they used to wear this pouch, and I believe it must have had garlic in it. But anyway, it was supposed to help them stay healthy. I think it helped them stay healthy because other people stayed away from them because they couldn't stand the smell, so they didn't catch all the viruses going around.
Well, them and the vampires. That kept away everything. Wow.
Right. So the other thing that makes it very important is just the mere communication. There can be a breakdown in what is understood. You as a provider may think that you have communicated very well, very clearly what needs to take place once the patient leaves your area, be it your office or the emergency room, and then they get home with a completely different take on what was said.
Right.
And it could be detrimental to the patient.
Right. Which is why it's good to have all these touch points, like the doctor says something, your nurse can follow that up, and it can always be someone else who asks, is there anything else you want the doctor to know?
That's very important because I have found some people don't feel comfortable saying certain things to their physician, and they feel more relaxed with the nurse or the medical assistant.
Yeah, or the front office person. It's interesting who folks will bond with, and want to ask one more question of, but you want to make sure that they're not giving misinformation.
I'd like to share an experience that happened years ago, like probably maybe when it was, I may have been a second year resident by this time, and one of our attendings was way back then astute enough to recognize the negative impact of the intersection of 3 different cultures that resulted in a bad outcome for a patient and almost resulted in that patient being placed on therapy unnecessarily. So this was a young child, first of all, that presented to the emergency room.
Yeah.
And they were of Haitian descent, and they had a Asian provider that took care of them for this rash. They were diagnosed as having scabies. So at this time, this was many years ago, like back in the 90s, at the time, the parents, they didn't speak English well. And they got their prescription and they took it to the pharmacy. The pharmacist happened to be, I think, Hispanic.
Okay. Wow.
And so they received their medications. They got 2 medication bottles, the brown medication bottles. One of them contained Lindane, and the other contained, I believe, Atarax or something for
itching. Right.
Okay. The parents, like I said, this was a 4-year-old child. The parents did not speak English well. They got the next door neighbor's child, who was then in 2nd grade, within their Haitian community.
Oh, wow.
And they read to them what they thought it said to do on the bottle. So when I encountered the patient, they presented to me with full-on seizures.
Yep.
and rolling it forward, trying to speed it up. They were admitted to the hospital. We couldn't figure out why they were having these seizures. The neurology specialist did the EEG. We did all the studies. So we were close to planning to send the patient home. She had no more seizures during her hospitalization. We were close to sending her home, and I never could figure out what this medication was. The parents kept saying she didn't start having the seizures until she started taking her medicine for the rash. Well, the rash that I diagnosed was atopic dermatitis. She had a bad flare, and she had been scratching, so she had eczema for all intents and purposes.
Yeah.
So I only prescribed something topical to treat her rash, but I still wanted to see what it was. When they finally brought the medication back in the brown bag from the pharmacy, and I read the bottle, the Lindane gave the directions to apply topically. They gave her the medication by mouth.
Wow.
Because of that breakdown in communication. And we almost sent that child home on daily anti-seizure medication. But we did do so after figuring that out. And so when you think about it, there were 3 different backgrounds that intersected, and there was not a clear understanding about what was supposed to happen for that child once they got home.
Wow.
She ended up being fine and doing well.
Thank goodness.
Fortunately.
Right. But how often does that happen and we don't know?
Right.
That it was something cultural was missed. I think I told you about a kid I had who was being a kid of Asian descent who was being looked at for possible child abuse. And what we found was that culture has a process they call cupping to help get rid of disease. And it's really taking a cup that applies suction to the back. And so this child looked like he had multiple bruises. And, not knowing that cultural significance, also a family that wasn't able to communicate what was going on, was being held for potential child abuse, which can be a whole big issue.
That's a whole traumatic event that the family has to encounter simply because they don't understand a common practice that they have within their culture. And I'll even take it back further. So that's something found on the skin. I've had patients from families being referred to Child Protective services for suspected abuse, but they had Mongolian spots, simple birth defects that are very common to be seen in children of color with darker pigmented skin. That's a common finding. And even back to the situation where I shared about the child that was diagnosed with scabies. Oftentimes in training, we are not taught how rashes can present differently on different hues of skin color.
That's right. Absolutely. And so even those, we know Melamed is primarily other medical doctors here, but we know others are watching us as well. So my word to those of you who may have some cultural things that are done in your family, that you do share that with your provider. My grandmother told us to put this little salve on, and you bring the salve so we can see what it is. Right. So that we're making sure that we acknowledge that that's something that could be helpful, but here's something that may be more helpful. Or let's not put that on anymore because that's causing an additional problem.
And we as providers, we need to make sure that we allow our patients and their families to feel comfortable. We need to be more open and welcoming so that they can have those conversations with us at ease without feeling they're going to be judged.
Absolutely. And for our colleagues, though, who are taking care of folks in our community, they have to also be open to hearing that. And we have, if you know, we certainly think there's value in having your care with providers who look like you. That's why we talk about that a lot, because we may be aware of things that others might not be aware of in all of our different communities. But again, all of us being open to hearing those cultural things that we may be exposed to.
I'm kind of laughing to myself because I was just reminded about another experience I had with one of my colleagues who happened to be Iranian, who was about to send a child. It was after the first day of school, and he was sending the child to the emergency room and calling the authorities on the parent for burning the child. And actually, they had put a relaxer in the child's hair and left it too long, and they suffered chemical burns. It was not purposeful.
Right.
He had no idea.
Right.
He did not understand. And so fortunately, I was there to kind of intercede so that they didn't roll into that whole experience of trauma.
It's interesting, all the things that we see. I saw a kid, and this is unfortunate, but we know it happens, where there was a burn to the lower leg. How did she get the burn? Mom dipping the braids.
Oh my goodness.
And the pot falls over. Ouch. But you're being brought in for this burn, and now there's this whole neglecting CPS involved, and it truly was accidental, but from something that we do culturally, doing braids and dipping the hair. So so many things that could cause you to think a different way about why it happened, and that it was not just accidental but purposeful. But if you know that cultural piece, you know exactly what happened.
And then also, let's just think about a few things within our training that we don't. I know I was never taught these things. Some things I have learned just from reading, and then others, I will say, I've picked up from Instagram. But for example, the way we treat our patients when we're monitoring with something as simple as the pulse oximeter.
Right.
So for those of you who are not aware, it's a little, like an infrared device that you place on the digits. For babies, oftentimes we will use their feet, and we monitor for the level of oxygen that's circulating through your blood. And based on what that level is, we will make decisions on certain medical interventions that may take place. But the fact of having darker skin color can interfere with how well or how accurate that reading will be.
Right. Well, and on the other side of that, when we talk about cultural competence, is the thought that because of your lineage or because of your skin color, that there are other things attached to that. So, for instance, when we look at those who are affected by kidney disease, we know that there are African Americans who are not on the transplant list because their GFR, which tells us about their kidney function, was looked at differently than others. So why is that? Why is that attached to African Americans, that their GFR would look different and place them at higher risk of not getting a transplant because they're not going to get on the list? For some reason, we're just looked at differently sometimes. And so these standards are applied to us that are not applied to others. So that's a cultural thing as well. That we have to look at the opposite side.
Disparities.
Exactly. So much goes into this that we have to consider. And again, I'm always, I saw a TikTok the other day where a young man was talking about not learning. He's a medical student and not learning a lot about how to care for those of his own community until he really gets out there. And so it still makes me very, very proud to have attended a Morehouse School of Medicine, where it was a part of my training, because the expectation was that I was going to be taking care of members of my community. And so it was integrated. Yeah. So important, but whatever medical school you attend, wherever you get your training, the community that you decide to work in, you definitely should make sure that you begin to understand as much as you can about that community, especially if it's different than the one that you are from.
Be well informed, be well versed about their culture so that you can indeed provide them with the best quality of care that they deserve.
Absolutely. I think that's a great way to make sure that all communities are cared for deeply.